Genetic testing for hereditary cancer risk. We have Fatima Amir, one of our genetic counselors here at Dana-Farber. She's a favorite from our past BPREP forums, and so we're happy to have her back this morning. So thank you, Fatima.
Thank you so much for having me today. All right, so today what I'll be talking about is genetic testing for hereditary cancer risk. And so a great place to start, if we just go ahead and go to the next slide, is to ask, what does it mean to have hereditary cancer risk? So I like to kind of do a little bit of a 101, genetics 101 piece first. So if we kind of think about our bodies, they're made up of billions and billions of cells. And in each of these cells, we've got all of our genetic information very nicely packed and organized. So one way I like to kind of help explain that is if you think about an instruction manual, within an instruction manual, we might have chapters that sorts out all the information. Similarly, our genetic information is kind of sorted into these chapters, or what we would call chromosomes. And just like within these chapters, you would find that the chapters are made up of different words. We have genes that make up the chromosomes or the chapters. So the genes are kind of like these words that code for different information. In total, in each of our cells, we have about 25,000 genes, and we, are always learning more and more about new genes. But typically, when we're thinking about, what's relevant to us today, we will kind of focus in on something called cancer risk genes. And these are basically genes whose function it is to protect our cells from becoming a cancerous cell. And for each of these genes, we typically have two copies, so one copy that we get from each parent. So this is kind of a little bit of an illustration for a fictional gene called theater. And let's say that this gene is kind of just spelt out, as you can see, and you've got two copies of it. So one copy you got from one parent and the other copy you got from another parent. Now, what does it mean to have an inherited genetic mutation? So if we kind of just click next. One of those copies of the gene, someone might be born with one of the copies that has what we might think of as a spelling error, or what we call an inherited genetic mutation. So as you can see, instead of an E and A in the word theater, it's now an X and a Q. So that means that that copy of the gene is not working correctly. And if the function of this gene was to protect the cell from developing into a cancerous cell, now this person has an increased risk to develop cancer compared to the general population, because you only have one copy of that gene working now. And so that is what we call hereditary cancer risk, is when you are kind of born with a change in your genetic makeup that increases your risk to develop cancer over the general population's risk. And knowing this can, of course, impact your care. And that's why we like to get that information through genetic testing. I do like to, however, provide some context. So most cancer is not because of a hereditary cause, like what we just described. When we think about all cancer, only about 5 to 10% of it approximately can possibly be explained by a hereditary mutation like we just talked about. The vast majority of cancer then is what we consider to be sporadic. So that can be because of some types of environmental factors, like exposures to chemicals or radiation over your lifetime. As we talked about earlier today in a really great presentation, exercise and other lifestyle factors can play a role as well. But we also know that nature isn't perfect. Our cells can sometimes just create an error when they are replicating all the genetic information in each of their cells. And so the aging process there can play a role as well in the formation of cancer. But also, if I quickly just focus in on that familial category as well, you might notice there's that little orange piece of the pie called familial. And what that really is where we might see that there are multiple family members that have a cancer diagnosis, but upon doing genetic testing, we're not quite identifying a genetic mutation. Now, there's a couple of possible explanations here. One possibility is that there are just genes we've not discovered yet that could be explaining this family's history of cancer, but there's also a possibility that there could be a shared environmental exposure. So perhaps a family living near a factory mill, maybe multiple family members develop cancer in that family because of a common shared exposure, but not because they were born with an increased risk from their genetic makeup. So when I meet with a patient, I typically draw out a family tree, kind of like what you see here. So just to orient you a little bit, circles represent females and squares represent males, and anybody who's traded in has had a cancer diagnosis. And below them, you can see their cancer diagnosis type and the age at which they were diagnosed. So what are some of the clues that stand out to me when I'm looking at a family? So there might be more cancer than expected in a family. So just like you see here, there are multiple family members here with cancer. There might be multiple generations of cancer, also as you can see in this family's example. People might be diagnosed with cancer at younger ages than you would expect. And typically from a breast cancer perspective, our kind of soft cutoff there is age 50. So under the age of 50 might be something that stands out to us as a clue for hereditary cancer. Sometimes rare types of cancer can also make us suspicious or might make it reasonable to consider getting genetic testing. So examples being ovarian cancer, which is typically pretty rare in the general population otherwise. Pancreatic cancer as well as metastatic prostate cancer. So that is prostate cancer that is spread beyond the prostate. Actually, in some of these individuals, genetic testing results could also impact treatment decisions, and that's part of the reason why we also recommend genetic testing for them. There might also be, people who have more than one type of cancer developed over their lifetime, or if we see certain patterns of cancer going together in a family. So that's also part of my job, is to look at the different patterns that I'm seeing in the family. So in this family's case here with breast and ovarian cancer, there is a well-known syndrome where we can see those two cancer types go along together, and we'll talk a little bit more about it in the following few slides. But if I'm going through this and you're thinking about your family, and this is where any of these clues are reminding me of your own family, you might benefit from a genetic counseling visit. So we'll have that information at the end as well. So what is the purpose then of hereditary cancer genetic testing? In short, it is to allow for screening, prevention, and risk reduction where possible. Another thing, as we've also mentioned, is in some cases it can also have treatment implications. And I think a good example to illustrate that is to use kind of the most well-known hereditary breast cancer syndrome called hereditary breast and ovarian cancer syndrome. And that is when someone is born with one copy of their BRCA1 gene or BRCA2 gene not working correctly. You may also hear these genes being referred to as BRCA1 or BRCA2. So here is my little visual illustration of two copies of the gene and one of them not working correctly. So for someone who is born with either their BRCA1 or BRCA2 gene having a mutation in it, they might have the following increased risks for cancers. So there can be an increased risk of breast cancer. And in females, typically, that's kind of the more pronounced risk. So recommendations for screening might include alternating between mammograms and breast MRIs. And for some women, they may also have they may consider the option of a prophylactic bilateral mastectomy, which is just a fancy way to say surgical removal of the breast tissue. And for males, there might also be a slight increased risk of chest wall of male breast cancer risk, and so we do then for them recommend chest wall exams starting at a specific age. There can be an increased risk of ovarian cancer as well, and typically for women, we would then recommend a risk reduction surgery where we recommend removal of both the ovaries and tubes after after a certain age. For males, there can be prostate cancer risk as well that's slightly increased. So we might recommend getting PSA levels through the blood, but also digital rectal exams as a form of screening after a certain age. Depending on the family history, pancreatic cancer screening might be recommended because we know there's a slight increased risk of pancreatic cancer as well. And that typically just involves 2 different forms of imaging as well to look at the pancreas. And then last but not least, there can also be a slight increased risk of melanoma, but the recommendation for that might not be very different from what many of you might already be getting, is just regular skin exams with the dermatologist. One thing I do like to mention is the increased lifetime risks of cancer are not 100%. So we're not getting to know this information just to give you scary information. We know that there might be an increased lifetime risk compared to the general population, but it is very rarely ever close to 100%. So one common question I get is, well, what does the genetic testing involve? So it typically involves us getting either a blood sample or a saliva sample. You know, what we actually look for can be variable. So, you know, we have kind of moved away from just testing BRCA1 and 2. They were kind of the more well-known genes. So back in the day, testing typically involved just testing for those 2. But as we have learned more in the world of genetics, and we're learning very fast, we have moved to casting a little bit of a wider net with what we call multi-gene panels. And these are basically tests where we're looking at multiple genes all at the same time. So just to give you a sense, there are other breast cancer related genes as well, besides BRCA1 or BRCA2, and they include some of the ones listed out here. So when it comes to thinking about how wide do we want to cast that net, we have a couple of different options typically, and that's something we discuss in the genetic counseling session. So you can choose to potentially, you know, if you're someone who's coming from a family that already has an inherited genetic mutation, some people choose to go with just testing for the single gene that has the mutation in it. And again, that's a decision that sometimes we make with the patient directly in terms of what's in their best interest. But sometimes people, we might choose to just look at kind of just the genes associated with the specific cancer type. So say someone is diagnosed with the breast cancer and they are kind of just really want the information related to their current diagnosis, we can try to kind of hone in on that a little bit more closely. Some people feel more comfortable with getting more information than that. And so kind of, I would say probably most standard that we often order, it can be a panel that kind of looks at the more common hereditary cancer. So we're looking not just at breast cancer related genes, but we're also looking at gastrointestinal cancer related genes and gynecologic cancer related genes. And really the reason for that is those are typically the types of cancer risks where there may likely be some types of screening recommendations that might be made. So even if it's an unexpected result, we might, our thought is we'd rather know that information than not know it if it could affect your screening. But then there's also more largely expanded panels that include newer genes and potentially genes associated with cancer types that are not covered in the smaller panels. And part of, you know, again, meeting with the genetic counselor is we kind of assess your family history, see what is the appropriate recommendation clinically, and then we kind of go from there to make the right decision for you. So what do genetic counselors do? I kind of like to think that we're kind of at the intersection of being a healthcare provider, being educators and counselors. So typically in our sessions, we will review your personal and family history to assess your risk. We will discuss benefits and limitations of the genetic testing, make sure we order the appropriate test for you, and interpret your results when they come back and deliver them to you. And then we also are equipped to provide psychosocial counseling. So we recognize that going through some of these sessions can bring up a variety of feelings for people. And so we are equipped to kind of provide that momentarily as well in the session. And then, of course, depending on the results, we work with other providers to ensure that any appropriate follow-up care is set up. So I wanted to make sure I left enough time at the end for questions, since I know a lot of people have really good questions when it comes to genetics. So here's some information also that I've put up in terms of our on our website for the Cancer Genetics and Prevention, what numbers you can call to set up an appointment with us. Or if you're joining us from beyond the Boston area, or kind of far away, where you're not, you have to find someone locally, you may be able to go to nsgc.org, where you can use their Find a Genetic Counselor tool to look for a genetic counselor locally in your area.